All right, welcome back. And it is back to school time for the greater Houston area. And this week can bring both excitement and it can also bring stress for students and parents. Dr. Krystin Holmes joins us this morning from the Harris Center to share little tips on how to kind of ease back into the school year. Doctor, thank you for being with us.
Thank you. Thank you for having me.
Okay, so let's share some things that, it can make this time stressful first for both parents and students.
Yes, so depending on the age of your children, back to school, it's always a stressful time. The littles, they kind of stay more on a schedule. Our older ones, they have been loving summer, right? They are
Sleeping
off bedtimes.
in, yeah.
Oh, that teenager sleep, how can I get that back, right?
Right.
So kind of getting back to that routine can be a challenge, especially when they're used to talking to their friends, social media, their phones, their devices. So that's one of the struggles, is just getting that routine, waking up early again.
Yeah, and just getting back into it. What would you say are some warning signs that parents shouldn't ignore if they start to notice different things? Are they subtle? Are they sometimes minor things that they can pick up on, or what are some things?
Sure. So they start small. In my experience, I see our little ones that they have a tummy ache, they don't feel good, they don't want to go to school. A lot of times they're excited about school, but sometimes they're nervous, especially if they're moving grade levels. So if they're going to a new school, they might show some of those somatic symptoms. I have a headache, I need to go to the nurse. Our older ones, if they avoid, they shut down, which is hard to differentiate between teenage moodiness and what's avoidance of school, right?
So that's the hard part, and figure out exactly what would you say is the best way? Just ask, because I think my kids get annoyed when I ask 20 questions when they get home from school. They're like, "Mom, I'm tired. I'll tell you later."
They have been asked questions all day, especially those first weeks back. There's a lot that's going on in school. Really just opening the floor for that dialogue. Maybe ask one or two questions that are open-ended. Tell me about your day. What was the most exciting part about your day? Be prepared for the nothing that teenagers like to give, and go, surely there was something you didn't hate about today.
Yeah.
But oftentimes too, at night before they go to bed, I like to do a check-in, which is where anything you tell me right now, this is our time to kind of discuss and to bond. And so that can facilitate a good conversation.
Oh, I like that. That's a good one. Okay, what are some things that parents and their kids can do at home to help manage some of the stressors?
Really finding out what the stressor is about. If it's about social anxiety, sometimes, we're facing those kids that maybe we don't really want to see. We've had a break from all summer, or academic pressure. Our kids going into junior year, it's a tough time for them. So finding out what it is that they're nervous about. Is it a new school layout? Maybe we walk the school, maybe we plan. Kids today have a lot more worries than I think we had as kids with social media and access to news and things like that. So really finding out, what is it that makes you nervous? How can we plan to the best of our ability and give our kids the absolute best opportunity to be prepared for their day?
Yeah, and be able to identify those feelings, right? To know, okay, I'm a little uncomfortable or nervous, but now I have the tools to just kind of work through it.
Yeah.
Okay, is it important for parents to validate feelings, whatever feelings they may be? Because sometimes our kids have big feelings. Well, we all have big feelings. We all do.
Right. So sometimes in our adult world, our kid problems seem small. And honestly, I'm grateful that they're small. I'm glad that your biggest problem is what color shirt to wear to school today, right? If that's your biggest problem. So I think getting on their level and recognizing, if this is the biggest problem you have in your day, it matters to me. So that way your kids come to you when the problem isn't so small, when it's a lot bigger. So setting yourself up for success as a parent to be that supportive, I'm on your team no matter what.
Yeah. Oh, I love that. Okay. When would you say is the time to reach out to a professional, when it's, maybe we don't know as much as we want to know, and it's okay to want to learn more about what is the dynamic in your family?
Sure. So I think whenever it gets to these extreme avoidant behaviors, when we're missing multiple days of school, if we're skipping school or starting to get excessive tardies, getting in trouble at school, we want to take the time to check in to get a third-party opinion. Definitely if you see any behaviors that are concerning, dangerous behaviors, risk-taking behaviors, we want to get a mental health professional involved, so that way we can understand, is there something more going on than just social anxiety or peer pressure or academic stress?
And then just want to go back to that one stressor, social media, or just being on the phone all day long, or just having access to it. How can parents, how do we say this, get them to not be on it so much, and not have that struggle, would you say?
The first thing, make them think it's their idea. Very difficult.
Yeah.
I think one of the best lessons that I learned as a youngster is that giving your friends access to you 24/7 isn't really a good thing. So teaching that boundary setting early. Hey, what time do you want to go to bed? At what time do you want no more drama from your friends? And allowing them to kind of set those healthy cutoff times. Saying, hey, let's work on something for 45 minutes, and then we'll pick up our phone and have some 15 minutes of just scrolling, right? Don't get into doom scroll.
Right.
Scroll forever.
Right.
But teaching them healthy habits around their cell phone that they can take into their work life, really, because that will lead into work-life balance one day.
Yeah, and maybe get moving. Just get outside and
Oh,
take a walk with your
100%.
kids.
Yes.
Yeah, that's a good time to talk to. All right, Dr. Krystin Holmes with the Harris Health Center for mental health as well. Thank you so much
Thank
for
you.
being with us. We will be right back after this.